In Uganda, diarrheal disease is the fourth leading cause of child mortality. Hand washing with soap can reduce the spread of communicable diarrheal disease by 50%. In the summer of 2010, we carried out a research study in rural Uganda to study the effectiveness of the Tippy Tap, a low-cost and sustainable hand washing station for the developing world. The device costs $1 and is built from commonly used materials such as wood, a jerry can, and string. It is so simple to construct that children are able to assemble the device independently in their homes. Our studies show that Tippy Taps with a complementary education program led to a dramatic increase in the number of students hand washing with soap after using the latrine. While the Tippy Tap technology has great potential, the real challenge lies in changing behavior so that hand washing with soap becomes an ingrained habit. To meet this challenge and address the high mortality caused by diarrheal disease, we proposed the Tippy Tap Sister School program. In PSU, or Pennsylvania Schools for Uganda, U.S. elementary schools will be paired with Ugandan elementary schools as a means of creating lasting behavior change by developing a program to foster global awareness and international synergy between schools. In the initial pilot program, we will pair the 8 elementary schools previously identified by our research in Uganda with 8 schools in the State College, Pennsylvania School District. We will be orchestrating the sharing of capsules. Our capsules will contain artwork, writing samples outlining a typical day, family structure, and future ambitions of the students, in addition to a class photo and student-designed health education materials. These different items, once distributed between sister schools, will help foster an educational dialogue and generate a global perspective that will lead to increased public scholarship in the future. This new international connection will also facilitate the promotion of U.S. school fundraisers to raise financial support for instituting more hand-washing education programs based around the Tippy Tap in rural Uganda. Lastly, the Sister School program has the ability to scale up and expand in Uganda and the United States. The program is innovative in that by fostering communication across cultures for the purpose of health promotion, Ugandan and American children will be empowered to serve as catalysts for the dissemination of health education to their peers, families, and communities. By expanding the Sister School program across Uganda and the Commonwealth of Pennsylvania, we aim to create a program that empowers children to be agents in health change while simultaneously providing sustainable support to increase the supply of soap, the number of Tippy Taps, and hand-washing educational programs in rural Uganda. Our ultimate goal is to further healthcare in Uganda by reducing the rate of diarrheal disease transmission through the continued distribution of low-cost hand-washing technologies coupled with educational programs.